Here's some interesting stats that I came across, and this is why we see pressure on services in this country and pressure on housing and driving house prices through the roof and pressure on our school system and our health system. There was a population projection statistic that I saw recently where they were saying that they were estimating by 2036 there would be like 5.8 million people in Ireland. We are now passing that, and we're passing that figure 11 years early, right? We're reaching that figure that the CSO had suggested we wouldn't reach till 2036. We're there now. There's about a 6% growth in the Irish population, they're reporting, whereas there's a 94% growth in the population of people who have come here as immigrants from overseas. Is that not alarming?
Neil, can I tell you this now? I spent a lot of time in hospital over the last 2 years, right? I know you would say, ask any of your listeners, if it wasn't for nurses, doctors, cleaners,
I'm not saying that.
No, but Neil, no,
I'm talking about if we've already passed the 2036 population projection, that's huge pressure on services. That's why kids can't see a dentist, orthodontics, scoliosis issues.
That's not true. That's not, like Neil,
it's not true.
That are not accurate.
It's not true.
Because if you go back 5 years ago, children couldn't get access to scoliosis. So before any of these figures came in, you had the homeless crisis, you had the health...
5,500 kids across Cork who can't get a dentist appointment.
Yeah, but Neil, the reason for
24 hours waiting lists in the A&E.
No, Neil, you won't let me finish, right? If you take those doctors and nurses out of the A&Es, the hospitals will close. And you know who's telling us this? This is not me. This is the doctors' unions. This is the nurses' unions telling us they're at collapse stage now. And if they were to lose those foreign nurses and doctors and healthcare workers,
I'm not saying that. I have no issue whatsoever in somebody coming here to work. I'm saying to some extent.
With the homes, no, you're saying. That
how do you make that out?
This, right?
That's not the case. The point I'm making, and it could actually be something that I should be lying at the feet of Fianna Fáil and Fine Gael. We have passed the population projections of 2036 now. They've dropped the ball when it's come to our health service, our education service, and housing. I'm not critical of you. I'm just saying this is the reason why it probably will get worse. I'm saying.
But Neil, the situation here now, we have less people living in Ireland now than we did during the famine. We're one of the few countries in the world that have less people living here.
But sure, that's irrelevant. We didn't have a health service then. We didn't have schools. We didn't have hospitals. We had nothing.
Yeah, but we're talking about, if you're talking about projections for figures...
Everyone died in the famine, man.
Yeah, and why? Because the British starved the Irish people who drove us to the four corners of the world. And when the Irish went over to places, you had signs up saying no blacks, no dogs, no Irish. People died in the coffee ships. They died of all different diseases. And so, Neil, what we are saying is there are solutions there to all of these issues. But this government, Fianna Fáil and Fine Gael, don't want to hear it. The unions, the dentists, you talk about dentistry, right? They're huge waiting lists, right? They won't give the dentist the money to look after medical card holders and young...
Can't get into a doctor's surgery. Can't get on a doctor's list, even if you have a medical card, even if you have money in your pocket.
I'll give you another solution.
But why do you think that? Is that not to do with population growth and surpassing the 2036 figure now? Surely it is.
No. The reason, Neil, is because the doctors are actually private businesses, right? What we want the HSE to do is to hire doctors directly and to work for the people, right? Like, a doctor isn't just a doctor now has to pay for all their staff, their premises. They're actually a business. What we want to do in Sinn Féin and in the other political parties on the left, we want to have doctors hired to deal directly, not worried about running the business, worried about their patients. And if we were to do that, we could recruit doctors and to clear the waiting list so that everyone will have access to a doctor. But this is all about privatisation. This is Fianna Fáil and Fine Gael. Big businesses, big companies, it's the same thing all the time.
Are you still there? The line's breaking up a bit. I'm getting example after example, but it's not a responsibility of Sinn Féin to answer as to why, because you haven't had a caught at government yet, but dental appointments to get your teeth cleaned, 6 to 8 weeks, and that's from a dentist that somebody's going to. The list is endless. And we spoke about housing lists, we spoke about education, we spoke about special needs assistance, people who are struggling day in, day out to get the services they need for a child on the autism spectrum. Is it any wonder that more and more people are leaving this country and closing the door, and a lot of them are professionals? Not all, many of them have the trades. They just can't be bothered living here and dealing with this and knowing that they'll never have a roof over their heads. If it were that simple, it would have been fixed.